It is a huge honor today on a lovely Saturday afternoon to be podcast interviewing Saul Pressner, DMD. Did I say that right? Pressner?
Yes.
And you're in Washington, D.C., but you're not at the ADA convention. You're at a family party. And the reason I contacted you and you didn't contact me is everybody keeps asking me, what is biomimetic dentistry? And you're the president-elect of the Academy of Biomimetic Dentistry, and you're on the board of American Friends of DVI, as well as on the Dean's Council of Penn Dental Medicine.
Yes.
So the reason I'm contacted you and you didn't contact me was, what is this biomimetic dentistry that everybody keeps hearing about?
Well, it's basically tooth-preserving dentistry, mimicking bio meaning life, mimetic meaning mimicking. We try to recreate what nature made for us in the first place when we restore teeth. You know, if a tooth cracks, for example, if you break off a cusp of a lower molar, for example, we were taught in dental school to prepare that tooth for a crown to protect the rest of the tooth from fracturing. But with new adhesive techniques and materials, we can build teeth back up instead of filing them down. So we just do it in a more predictable way now.
I think some of the things that us humans believe are just crazy. Like on the craziest I believe is a lower mandibular incisor, and we're taught that every tooth that has a root canal needs to be crowned. Well, by the time a lower incisor has had the root canal, by the time you file it all the way down for the crown, I mean, it's not even a grain of rice. So
exactly.
We've destroyed 95% of the forest to save it. I'm the old saying, I will burn down this forest in order to save it.
Yes.
Isn't that what a lower crown on an endodontically treated incisor? Isn't that what it is? I mean, when you crown an incisor tooth just because it had a root canal, isn't that kind of burning down the forest in order to save it?
Yes, absolutely. And with modern adhesion, you make a very small access opening for the root canal therapy. You have all this enamel left that you can use to reinforce the tooth against biting forces. And when you put in a biomimetic composite restoration, which bonds really well to the dentin and to the enamel, you're reinforcing the remaining tooth structure. So it's a much stronger tooth than it would be if you filed down all the enamel for a crown.
So you guys have an association or a meeting, or talk about what are you you're the president-elect of the American Academy of Biomimetic Dentistry. Tell us about the Academy. What's the website?
I'm actually president now. It's the website is www.academyofbiomimeticdent.org, and we're an international academy. We have one large meeting once a year. We just had it in Philadelphia about 2 weeks ago. It was the first time we had our meeting on the East Coast, because we really felt that it's been a West Coast phenomenon so far, and we really felt that dentists on the East Coast should be exposed to this information and try to preserve more tooth structure. And we have several other smaller meetings during the year. We have videos of our lecturers. We have literature reviews. And the website is an educational resource to guide our members in terms of how to learn about the latest material being presented.
So so tell us more about it. Why should people join this society? So I just found academyofbiomimeticdent.org.
Correct.
Well,
yes.
So why should people join that? And what are some takeaway lessons for the thousands of dentists listening to you right now that are not members? How could they be more biomimetic, more bio meaning life? So biology study of, so biology is the study of life.
Right.
And mimetic is bio would be life, and mimetic is what'd you say? Mimicking. That's the word I was looking for. Mimicking. So with adhesive dentistry, so basically your goal, it's kind of like minimally invasive. Would you say it's more the marriage of minimally invasive dentistry and adhesive dentistry, of trying to just save more tooth structure? Is that?
Yes. It's all of those things in a in a very well sealed environment, sealing out the bacteria so that the things we teach in biomimetic dentistry allow restorations to last longer. And we follow specific protocols. We use rib-on fiber within our composite restorations to reduce stresses within the composite and to reinforce the remaining walls of enamel and dentine. And we learn about these techniques based upon the latest literature. So everything that is taught at our meetings and in courses that we give is based upon peer-reviewed science. So dentists who come to our meetings and become members become very well educated in the literature so that they can feel confident that the treatment that they're rendering is based upon the latest science. And that's a real big plus for patients. And they're also learning how to restore teeth more conservatively, and thus these teeth are going to hang around for a much longer period of time. Patients are living longer, and they want to hang on to their teeth. You know about the cycle of tooth death? I'm not sure if you know about that. Basically, you start out with a simple amalgam filling, and a cusp breaks off, and you then end up doing a crown. You do a crown, and a lot of dentists believe in doing is just, as you said, Howard, before, prophylactic endodontics. Teeth that have had endodontics and have had cast posts or prefabricated metal posts made, in addition to the crowns, the literature now shows that those teeth are much more likely to be lost sooner than teeth that are restored more conservatively, like the example you gave about the lower anterior incisor. So by becoming members of our organization, members are networking with like-minded dentists and learning about the latest literature, materials, and methods to restore teeth more conservatively, more economically for their patients, and it's a practice builder as well. Patients like not having their teeth filed down as much and holding on to their teeth longer.
Now you're in New York, New York. I'm a Kansas boy. Whenever I see New York, New York, does that just means Manhattan and not Brooklyn, Bronx, Queens?
I'm in Manhattan. Yes, I am in Manhattan.
But is that true though? Does New York, New York mean Manhattan?
It does, because there are 5 boroughs of New York, and if you live in Brooklyn, it's Brooklyn, New York, or Staten Island, New York, Bronx, New York, Queens. It's Manhattan is signified by New York, New York. Yes.
But all those boroughs call themselves New York City.
Yeah, they're all part of the 5 boroughs are all part of New York City. That's correct. Yeah.
that is a confusing culture.
It is. It's a very confusing culture. Yes.
Yeah, where each borough calls its name. But so you're so in New York, your website's newyork-cosmeticdentist.com. So do you feel that biomimetic dentistry gives you a competitive advantage in what I think is probably the most saturated city in America? I mean, how many dental schools does New York have in just the city?
2, NYU and Columbia.
But the class size of NYU, what is the class size of NYU and Columbia?
Yeah, I think NYU has a very large class size. I think they have probably close to 200 in each class, and then they also have an evening program for foreign students. So,
and how big is that?
I think that's probably another 200 students per class as well. Yes.
So for each school has the foreign too?
Columbia has, I believe, a foreign program as well, but Columbia's class size is, I think, about 120. It's smaller than NYU.
So you guys are dumping out 1,000 dentists a year.
That's true. Yes.
500 a year in little bit, and Manhattan's only what is Manhattan? 20 miles by 4 miles? I mean, what is it about?
I think it's about 20 square miles. Yeah, I mean, not all of them stay in Manhattan. They can't. And dentists retire. But
I think the most interesting statistic about Manhattan is that if all 7 billion people on Earth lived at the density of Manhattan, we would all fit on the island of New Zealand.
Really?
Isn't that interesting?
And I know a very good dentist in New Zealand, Graham Milicic, who lectured at our meeting.
Now, yes, Graham Milicic is. I saw that Graham Milicic in New Zealand, and then I always think of his one of his best friends in Australia is Jeffrey Knight.
Jeffrey Knight, sure.
And those are the two. Now I wanted to ask you about that. Is it my perception or not? Is this right or wrong? But it seems like when you meet the 2 million dentists around the world, as they get closer to Tokyo, Japan, where GC General Chemical is that makes glass ionomer, whether it's New Zealand, Australia, Hong Kong, you see much more glass ionomer used by dentists as they get closer to Japan. And as
Right.
they get further and further away from Japan, like by the time you get to Kansas, it's pretty much gone. And
Yeah.
what do you think about that?
Well, I think glass ionomer has its place. I agree with you. I don't use it much. I think that you get much better bond strengths with dent and bonding materials, self-etching primers, for example. So I don't use glass ionomer that much, except in certain cervical class 5
But it
cavities.
seems like that's the trade. It seems like when you get really far away from Japan, they'd say, well, I just get better bond strengths with resin. So it's more of
Right.
a civil mechanical engineer approach. And then
Right.
when you get closer to Japan and Graham Milicic and Jeffrey Knight in Australia and New Zealand, they say, well, we're fighting termites, and I want this barn to be antibacterial, and I'd rather have some kind of active ingredient in my restorative material. And you
Right.
Americans are always trying to build a house, and it's always going to get destroyed by termites, and we're trying to build an aluminum barn that's more antibacterial towards the gram-negative facultative anaerobes trying to eat it. Do you buy into? Do you think glass ionomer gives you an antimicrobial edge?
I think it does for a period of time, but I use Curare Protect Bond as self-etching primer, and that has an antibacterial component to it as well as releasing some fluorides. So,
And
um,
that's Japanese too.
yes, it is. That's correct. Yes, yes. And I prefer that product because it's got better dent and bond strength than
And what's the name
glass
of that
ionomer.
product? Kurari what?
Curare Protect Bond.
Kurari Protect Bond. Yeah, I think the Japanese got this figured out better than anyone.
They're great. Their materials are wonderful.
And,
Yes,
and the most Japanese dentist I know in the United States is our good buddy Ray Bertolotti.
absolutely. Who also spoke at our conference. Yes.
Yeah. He should have been born in Tokyo. He's a misplanted. He's a misfit. Like that. Remember the Santa Claus reindeer where they had the island of misfit toys. Raymond
Yes.
Bertolotti was born in the wrong country because he really does think Japanese, don't you think?
He does, and actually, he studied with Professor Fusuyama, many years ago. And at our meeting, we just had Professor Inakoshi, who also studied with Professor Fusuyama. And both Ray really brought a lot of the Japanese philosophies to the United States in terms of total etch, and he's brought self-etching technologies too. And he's really gotten on board with the biomimetic approach as well.
So go through some of your other speakers. Charles Cox.
Yeah, Charlie Cox actually. Charlie Cox did a lot of definitive histologic studies on dentin and the smear layer, hybrid layer. And I remember hearing about Charlie Cox first during Ray Bertolotti's lectures. I've been taking Ray's courses for over 30 years. And Charlie is an excellent dental histologist, and he spoke about the anatomy of dentine and the hybrid zone, and how the dentin enamel junction is a transition zone. He just gave us the background and the histology. He also studied with Professor Fusuyama in Japan. We also had
Does he still practice, Dr.
No,
Fusio?
he teaches part-time and does research.
In Tokyo?
No, university. Well, he does it at University of Michigan, but he spends time in Tokyo as well, doing research projects with some other Japanese researchers, such as Professor Inakoshi, Professor Tagami, and he's in the midst of doing some research with Curare as well.
But he works with the University of Michigan?
Yes.
Do you ever see him when he comes over to Michigan?
I don't actually. I only see him when he comes to my meetings, but I speak to him regularly. He's actually also going to be the editor-in-chief of our new Academy of Biomimetic Dentistry journal. He's going to be compiling the articles, which we're going to do on an annual basis.
Wow. Can you email me and CC me, Howard at Dentaltown, and I'll try to get him on one of these too?
Sure.
Podcasts?
I will make a note. Absolutely. Love to.
So tell us about Marcus Blatz.
Great guy. He's head of restorative sciences at Penn, and I went to Penn for dental school, and Marcus knew that I have been lecturing a little bit about biomimetic dentistry, and there are two schools in the United States at the present time, and others are following, that are trying to educate their students in more conservative techniques. Penn is one of them, and USC is the other one. Pascal Mann is at USC. And Marcus has been trying to teach his students to do partial coverage restorations. He gave a lecture at our meeting as well. And the message is simple. Studies show that the more tooth structure you preserve, the longer the tooth is going to last in the patient's mouth. And it's better economically and physiologically for the patient to have their own teeth. Implants don't always work. Implants are really a treatment of last resort, in my opinion. If it were me, I'd much rather hold on to my tooth. And you're much more likely to hold on to your tooth if you do a partial coverage restoration than a full coverage one. And Marcus is more interested in indirect restorations. But in our academy, there is room for variation in terms of preferences and techniques. Not everyone owns a CADCAM or E4D machine. It's too expensive for some dentists, and it's just not warranted. I don't own one myself. I do a lot of direct composites. And Simone Della Peri, who was one of our other lecturers, lectured on direct composite fiber reinforced restorations. And a lot of these restorations can last many years. You don't necessarily have to own a CAD-CAM machine to practice biomimetic dentistry and good dentistry.
But wouldn't you say the opposite, that a CAD-CAM machine is the opposite of minimally invasive dentistry or biomimetic dentistry? Because
No.
you're having to drill down and destroy more tooth structure to fit your technology. I mean, that indirect restoration has to draw. When I do directs, I just remove the decay and put in my direct. But when you have to sit there and destroy all this tooth structure just so that your optical scanning and indirect machine works, I mean,
You're right.
I mean, who's the doctor? Who's the doctor? The R2D2 CAD-CAM or me?
I'm in agreement with you, which is why I don't use one. I chase the decay and I preserve more tooth structure that way. I'm with you. However, with CAD-CAM technology, from what I understand, you can still preserve more tooth structure if you're doing a partial coverage restoration than you would if you're doing a full coverage restoration. So there are compromises that dentists have to...
Repeat that, what you just said. What?
Oh, well, all I'm saying is that you can do a CAD-CAM partial coverage restoration as well. It doesn't have to be full coverage. But
it still has to draw. An indirect
still has to draw. It still has to draw. I prefer doing it direct for the reasons you mentioned, but that's my preference.
I want to ask you another thing. This whole business was started with a guy named G.V. Black who was talking about extension for prevention. But I was wondering today, if your grandson came in and he had an occlusal on number 30, would you prepare out all the pits and fissures before you did an occlusal? Well, and then number two, what if your grandson was extra bad and had a MO flossing cavity? If you took out that mesial decay, would you extend the box out so it could be reached by the toothbrush bristles? Talk about both of those, extension for prevention on the occlusal, and would you bring out the box interproximally so it could be cleaned by a toothbrush?
Right, I would not do that. I'm sure you've heard of Tim Rainey, right?
Sure, in Refugio, Texas.
Yes. Well, Tim Rainey was one of the early advocates of air abrasion. So if my grandson had an occlusal cavity on number 30, let's say, I would... Would
you spank him first?
I don't believe in that. But I would use air abrasion to clean out the occlusal decay, and I would do a separate restoration there. And then I would do a little slot preparation on the mesial and not extend it necessarily to the buccal or lingual, breaking the contact. Because with good adhesion and with good flossing, it should last.
And what is your air abrasion machine now? What are you using?
I actually use a micro etcher by Danville.
That's what I use. You mean the little one, the little Danville?
Yeah, that's what I use. Yeah.
Yeah,
it works.
And what's the aluminum silicate? Is the powder?
Aluminum oxide.
Aluminum oxide, and isn't that the second hardest substance on Earth next to a diamond?
I didn't know that, to be honest with you.
I read that. I could be wrong, but I love that thing. Now, in all honesty, my dental assistant, Jan, hates it because it makes a mess.
It does. I know.
And I say, you haven't seen a mess until you've gone to my home. But What do you think of that? I mean, it just cleans everything off. I mean, that aluminum oxide man, it's nice.
It's
And
great.
I don't care that there's white aluminum oxide powder everywhere. I just don't care.
I don't care either. And I try to use a rubber dam whenever possible.
Yeah.
I use high-speed suction. And it usually, when you're doing it, if it's an occlusal, for example, oftentimes you don't need anesthesia. So, and
Right.
it's minimally invasive.
Yeah, and and I tell, and a lot of times when the staff or someone's getting upset because I'm making a mess, I say, have you ever seen a hospital when they do a bypass? I mean, these people are naked and flayed open. I mean, if you come to the dental office dressed for church on, then
Wrong
maybe,
idea.
yeah, maybe that's the wrong idea. Maybe you shouldn't dress for your dental appointment. Maybe you should dress like you're going to the gym or
I
running
agree.
5 miles and not going to church because I think it's again, you're talking to thousands of dentists, and I believe a lot of them don't know what biomimetic dentistry are. I'm talking to the president. What if someone's listening and says, I want to learn more about biomimetic dentistry? What would you tell them?
I would have them go to the website, www.academyofbiomimeticdent.org. They can call me. They can call me in my office. I will be glad to talk to them. And my office number is 212-249-8999. And I'd be happy to tell them more.
212-249
8999.
8999. Boy, you like nines.
Well, my birthday is the 9th.
8999.
I was born on the 9th of the month I was born in, so I guess that's why. I don't know. But I'm happy to talk to anybody about it and tell them the advantages. I mentor people, and it's my pleasure because I think ultimately we're here to serve the public and do what's in the best interest of the patient. It's not about, economic gain. It's about doing the right thing. And the economic gain will come if you do the right thing by patients and do no harm. That's really what I feel. So.
Yeah, and you'll get more word of mouth referrals.
Yeah, exactly.
Yeah. And that's Academy of Biomimetic.org. Academy of Biomimetic, Mimetics, MIMETIC, Dent, DENT.org.
Correct. Yes.
So you talk to Ray Bertolotti much anymore?
I do. I speak to him, a fair amount. He spoke at our meeting. I didn't make it out to Yosemite this year, but I heard him speak in Tahoe in June. He's a great guy. Ray really is responsible for me getting involved in this. I took my first course with Ray over 30 years ago, and he changed the way I looked at dentistry. And about 10 years ago, I noticed on Ray's website, I was about to sign up for another one of his update courses, and I noticed something about David Alleman. Have you heard of David Alleman, by the way, Howard?
David Alleman, spell it.
Alleman.
Okay, not ringing a bell.
Okay, well, David Alleman.
Don't tell him I said that.
I won't say a word. But David Alleman was mentioned on Ray's website, so as a recommended course that Ray thought people would benefit from. So I called Ray and asked him about it, and Ray said, well, it's basically what I do, but 2.0. And it's just more involved, but very interesting, and you should give him a call. So I did, and I ended up taking Dave Alleman's course called 6 Lessons. He practices in Provo, Utah, and he is the one who went through the literature and came up with these biomimetic protocols.
And say his name again?
David Alleman, Alleman. Alleman.
And he's in Provo, Utah?
He's in Provo, Utah.
That's where Gordon Christian is.
Yes, he's not far from Gordon, correct.
And Dent Supply, or Dentrix.
Ultradent,
Dan Fisher.
Right.
Okay.
Right. Yeah, Dan Fisher, right. So I took Dave Alleman's 6 Lessons course, and it just gave even more scientific backup for what Ray had been preaching and teaching all these years. So that really got me turned on. And I took some other courses from Dave, and then I went to Italy, to Sardinia twice, to take courses from Dave's partner, Simone Della Peri. And he really has developed wonderful protocols for restoring posterior teeth directly with composite with using rib-on fibers. You know David Rudo too, I believe, right?
Right.
Yeah.
The guy that looks like Einstein that's always riding a bicycle at dental conventions.
That's him. Yeah, he's great. Same birthday as my father. It's so funny. So anyway, I took those courses from Simone Della Peri as well, and I just became better versed in the literature and in the techniques. So I began to lecture a little bit about it. I lectured at Penn, I lectured at Columbia, and I've lectured to a few study clubs. I'm basically a novice lecturer. I've only lectured about half a dozen times about biomimetic dentistry. But I became involved with the academy. We helped, through Dave Alleman's blessing, we helped develop this academy to try to reach out to more dentists and teach them the techniques. And that's how that's been the evolution for me.
That is a wild evolution. So, is there any principles of biomimetic dentistry that you can teach now? I mean, like names and procedures, or materials or techniques that you're more likely to do if you're a biomimetic dentist than a non.
We try to reduce the C factor as much as possible. We try to have gingival margin elevation.
What do you mean reduce the C factor of inflammation?
No, C factor, the ratio of bonded to unbonded surfaces within the composite. We try to create cavities that cause less stress for the restorative material and for the tooth structure surrounding it. So if you have a lower ratio of bonded to unbonded surface, you have less likelihood of the composite fracturing or of the tooth fracturing. So these are one of the things that's taught in these biomimetic principles.
Can you try to explain that a little bit more?
Yeah.
How do you reduce the C factor? 101. Because when you said reduce the C factor, I mean, the first thing I thought of was the C-reactive protein.
Yeah, right. We want to worry about that also for our heart. We basically try to make smooth line angles. We try not to create deep boxes. You know, if you have a deep box, we try to elevate the box using good isolation techniques so that the composite is placed incrementally, and it's hard to me to explain it more than that. I'm not such a great lecturer, but we basically try to reduce the stresses within the composite by creating less surface area to bond to, and we try to create bonding to the best surface. I'm not explaining it that well, I don't think.
That's okay. What does your group like any of these new materials? You see all these bulk fill composites releasing now.
Well, one of the ways of reducing C factor is by placing composite incrementally. We don't really believe in bulk fills at this point because bulk fills cause more stresses within the composite and within the surrounding tooth structure. So studies show that incremental filling with composites is better for the long-term longevity of the restoration. However, some of these bulk fill composites have good material properties. So maybe using some of these bulk fill materials in an incremental way might be a good thing. But that kind of defeats the purpose of the marketing of these bulk fill materials. But I don't personally believe in bulk fill materials at this point.
A lot of people say the two biggest pitfalls of adhesive dentistry is that they're not isolating, they're not using rubber dam, they're not using isolate, so they can't do adhesive dentistry because they don't have an isolated environment. Do you always use a rubber dam or an isolate, or what do you do to keep a clean tooth to do adhesive dentistry?
I usually use a rubber dam on lower teeth because I prefer that to the isolate, and it's very important to have a good result to get good isolation, especially in the mandible. In the maxilla, truthfully, I don't always use a rubber dam because I can get really pretty good isolation in the maxilla. But I think wherever you can use a rubber dam or the isolate, if that's the preference, is good for the long-term prognosis of the restoration.
And then a lot of people are saying that if they go into 100 dental offices, just like they follow the Benco rep, and they'll just follow a Benco rep for a week, and they go into the offices and test their lights. A lot of people are saying that half the curing lights don't even work.
Yeah, you have to monitor your curing light with a meter on a regular basis, like on a weekly basis.
So what curing light do you have, and do you monitor your curing light? Do you measure your curing light, or?
I'll be honest with you, I probably don't measure it enough.
But do you order supplies online, or do you have a rep that comes by?
I have a rep from Henry Schein or Banco, both of them that comes by, and I order from them. I let
But
my dental assistant
but
order.
they'll
So
they'll use they'll measure your light if you ask them.
I'm sure they would.
Yeah.
I do have a meter. I test it, you know, every several weeks. I probably should do it every week, optimally.
So is there any composite material name brands that you like?
Yeah, I like Tokuyama Estelite Sigma Quick. I could use it anteriorly and
Who
posteriorly.
who makes that? That's got to be Japan.
Yeah, there you go.
But
Tokuyama. And I
what
found out about that through
is
Ray
that?
Bertolotti.
Is that a name brand?
Yeah, it's a name brand, Tokuyama. It's a
We're gonna have to ask you to spell that.
Tokyoyama.
TOK.
And Estelite, Estelite, Sigma Quick. It can be used, it's a composite that can be used anteriorly and posteriorly. It polishes really well, and it has very good wear strength and compressive
Huh.
strength as well.
That is interesting. I never heard of that. But again, so
It's good.
Ray Bertolotti turned you on to that.
He did. And I use, as I said, I use self-etching primers a lot. So I use Protect Prime and Bond, um, which is a very good antibacterial material. It bonds very well to dentin as well. And I still etch the enamel though, because you're supposed to etch the enamel. If any uncut enamel does not, you do not get as good a bond with self-etching primers on enamel as you do with onto dentin. So I still etch enamel first prior to priming the dentin and bonding the dentin.
So what other products do you like? What for your crowns? If you're going to do an inlay onlay crown, are you doing chairside CAD/CAM, or are you taking impressions sent to a lab, or how are you doing that?
I take impressions and send them to a lab. I usually use Emacs for anteriors and premolars. And I actually still, on lower second molars, I still use gold. I love gold.
On lower second molars,
I still do gold. I have a great lab that does beautiful gold work.
and
So,
why just lower second molars? Why not
well,
upper second molars?
I have a tough time convincing patients. I'd love to do it on upper second molars, but sometimes you can maybe see a little metal more in an upper molar. So I have a little difficulty selling a patient on gold on an upper molar for
This
aesthetics.
is Dentistry Uncensored, and you're never supposed to talk about race, religion, politics, sex. So let's start with race. I've had a lot of success talking Hispanics, Native American Indians. I mean, we're talking females. All mine are gold. I can always get a short, fat, bald guy that looks like me to go with gold. If I tell him, dude, if you go gold, you'll take it to heaven. If I make it all pretty for you, I can't guarantee you'll take it to the and
I agree.
old, fat, bald, ugly guys like me say, yeah, do what's best. But with
Absolutely.
women, I have no success with white European women, but I can get a lot of my African American women, a lot of my Latinos, and a lot of the Native American Indians. I'm across the street from the Guadalupe Indian Reservation. Those girls, they're like, oh, go better, go for it. But
Yeah.
man, white women, you can't get a white, and she'll have 7 gold earrings, a gold necklace, a gold bone through her nose, gold around her ankle, gold navel, gold, sticking out of 14 body parts. And then I'll
Right.
try to say second molar gold, and she looks like I'm a Martian.
I was just going to
Is
say
that
that
the way it
they
is in
look
Manhattan?
same. Yeah, it's the same. They look at me like I'm from Mars.
But is
They
that
say
only with white? Is that only with white European women, or in Manhattan, or are you getting Puerto
I would
Ricans,
say
Hispanic? Will they go gold?
I would say they're more likely to. I would say white European women will not. They want tooth-colored materials, even though they won't last as long. And I tell them, I give patients the advantages and disadvantages of every material and every procedure that they can have on their tooth, because I think that's only fair to inform them, and then they can make an informed decision.
You know what I
Uh,
think you should do? I think
what?
you should go. You're in New York. That's the cultural center of North America. I mean, that's
Right.
just. I mean, I can still remember. I grew up in Kansas, where the tallest thing was a grain cellar, and I can still remember. I was with Craig Steichen. It was August 9th, 1990. We flew to Manhattan, And when I first saw it out of the window, I thought it was Star Wars. I mean, it was like the Grand Canyon inverted. We were just looking at that thing, staring out the window. We were 21st home. We were just saying, no, we were 27, just looking at that thing, going, damn. And then we got off the plane and we hit Manhattan, and we're just excited. We threw our bags in the room. We walked down the deal, and we're just walking block to block. Next thing we knew, I said to Stike, I said, God, my feet are kind of sore. We looked at the clock. It was 3 a.m. We had just been running from block to block from like 9 to 3. We lost all concept time. But you know what? What if we found like Lady Gaga and talked her into going with like a gold bicuspid crown, or some white woman role model that tells these girls, look, you wear gold everywhere else on your body. It lasts forever. Why do you have a gold wedding ring on and you won't have a gold bicuspid? That woman is intellectually cerebral. I have always thought it was funny that Marilyn Manson and Lady Gaga, the press makes them out to be crazy, but when you hear them interviewed, they're probably 2 of the smartest people I've ever heard on an interview.
I'm sure that's true.
Have you noticed that? So you're taking impressions and sending to a lab, or are you doing oral scan? And what is your impression technique? And what impression?
I use a lot of Danville materials. I use actually, do you know Jeffrey Hoos?
Yes, his impression technique. Talk about that.
H&H technique. I love it. I learned. I'm a friend of his now. I learned about that from him at one of Ray's courses in Manhattan. He went through it. I use stiff bite, which is similar to blue mousse. Have the patient bite down in a triple tray, and then for about a minute, then I have the patient open, and I hold the impression in the opposing arch, and then I inject first quarter, which is also a Danville material, have the patient bite down again, and for about a minute and a half, and then I have a beautiful impression. I often don't use retraction cord, but I also don't have the need to do full coverage much. So most of the crowns that I do are retreatments of old crowns that have had recurrent decay.
Now, what is that? He called that impression material HT?
Oh, the impression technique of Jeff Hoos is H&H.
And what does that stand for, H&H?
You know what? I don't know. I don't remember. I'm sorry. I don't remember. It was a long time ago.
But basically the concept of Jeffrey Hoos' impression was you take an impression first, and then you shoot in a softer, lighter bodied and it goes in under pressure.
Correct. Exactly. It gets into the sulcus very well, because when you use a blue mousse like material, which stiff bite is by Danville, it has no resistance when you put it in, and the patient is you're able to monitor the patient's closure very well on the opposite side. And then you have the patient open and you put in a light body material, and that material, the first material, sets very hard, and just as you said, the compression presses the light body material into the sulcus, and you get a very accurate impression.
And you think that's a good impression technique?
It's excellent. I mean, I rarely have remakes. Yes.
And these are Danville materials. Now, Danville, wasn't Ray Bertolotti used to be, wasn't he part of Danville Materials? That's kind of a suburb of it's actually Danville, California. Isn't that a suburb of San Fran, or near San Fran?
It is. Yeah, because Ray lives near there and practices near there. Yes, exactly. Yeah. That's his. I'm not sure if he still is part of the company or not, but he was a part of the company, and he certainly helps them develop materials to this day. So.
Yeah, and a lot of that help is he's finding it overseas in Japan, right? I mean, that his big area of exploration.
Yes, and the Japanese, I think, are really, they're so methodical and thorough in their research and in their materials that a lot of their materials are just superior to ours, in my opinion. And the research.
It's funny, my opinion of looking at dental companies around the world. The Americans believe that you go into American companies and their marketing department is the biggest department in the whole company, and they might not even have one single PhD researcher, and they're doing 100 million a year, and it's just they got a 30-person call center, and they just they could sell anything to any dentist on earth. Then you go to Germany and Japan, and they just have all PhD scientists, and they don't even have a marketing department, and they just believe that if you make the best product in the world, it'll sell itself.
It's more pure. That's what I believe in, exactly. I want to use the best material. I don't care about marketing.
And then you go to China and they just believe that if you make this so cheap and so inexpensive and so low cost, people will just buy it out of morbid curiosity. And I always think the Americans and the Germans and the Japs they all need to learn from each other. The Americans all need to double down on PhDs and research. The
Right.
Germans and the Japanese need to learn for the first time how to market and advertise. They still are completely clueless when it comes to marketing and advertising.
You're right. It would be a perfect marriage. I
Oh
agree
my
with you.
God! That all the American companies should buy a German and a Japanese company, and the Americans will bring the advertising and marketing, and the Germans will bring the PhDs, and be a perfect marriage.
The quality, exactly. I agree.
But it's true. I mean, I remember going lecturing to a company in Switzerland, right at the base of that big old mountain, the Matterhorn, and
Yes.
and I mean, these guys they didn't even have a marketing department. And the guy was looking at me like, well, can't you just go back and tell your friends? I mean, that was their understanding of marketing. Unbelievable. So this mimetic dentistry. What lab do you use?
I use a lab who I've used he's a one-person lab for about 30 years. He's in New Jersey. I'd rather not give the name on this podcast, but if someone calls me, I will give them the lab because I want him to have time to do my work.
Yeah.
He does beautiful work anteriorly and posteriorly, and he's about my age, so I plan to practice for many more years, and
Well,
he
what
does
is
too.
your age?
I'm 62.
And how many years do you want to still practice?
If I'm healthy, which I seem to be, I'd like to practice till I'm 80. I mean, I may not want to practice quite as long hours as I do now, but I really love what I do, and I'm just trying to make a difference and do the right thing for my patients. I love my patients.
So why is it everybody that's wrote a book in my library here, they were all found dead at their desk or at their job. I mean, or the battlefield. I mean, none of them retired. And I think it's interesting. You know, you're 62 and you want to go to 80. Don't you think it's a red flag when some 40 or 50-year-old dentist says, I want to be retired in 5 years, and he's just socking away all this money, just wants to get out and he wants to retire? I mean, Mother Teresa at Calcutta never retired. Popes die in the office. I mean, what? Don't you think when I listen to a guy like you, dentistry is a vocation. You have a purpose, a cause. You're helping people, and you just want to die in the operatory. And the ones that just want to get the hell out of dentistry today, I don't think they have a vocation. I think it's an occupation. They hate it. They're trading time for money. What would you say to that 40, 50-year-old kid? Because I'm thinking maybe joining your biomimetic dentistry, you know, I just want the dentist to be happier and healthy. And sometimes, you know, if they buy a laser or they go to LVI or, you know, they get into sleep medicine or 6-month ortho, I just see so many dentists that were just kind of, they weren't having fun. And then they added something, and it just gave them vitality and life. And
this has done that for me, and you know, it's really honed my skills, and it's given me a scientific basis for what I do, so I feel better about what I'm doing for my patients, and I also feel that I'm doing something that's more economically viable for them. You know, a lot of dentists burn out, I think, because they're doing all these crowns, they're doing all these laminate cases, and they're exhausted. And I think at the end of the day, their inner soul is telling them, maybe I could have done this more conservatively and for less money for my patients, and it would have been a better service. Less is more often, you know. So, and maybe that's why I feel I can practice till I'm 80. I do yoga every day, I meditate, I exercise, and I try to eat right, and I try to do things in line with what I think is proper for our patients. We're supposed to do no harm. And I see a lot of young dentists, unfortunately, they're in a lot of debt coming out of dentistry, so they go to these mills, and it doesn't feel good necessarily at the end of the day what they've done. You know? So I think this is a good answer. You can build your practice by doing the right thing for patients. You won't make as much money necessarily, but you may be able to practice longer, and you'll feel better about yourself at the end of the day. That's my feeling. So.
That was just poetry. And whenever you do something you don't feel good about for money, it's always going to have a rebound effect.
Yes.
And come back and bite you in
exactly
depression, substance abuse, irritability, anger issues. You know, you can't. I mean, every single monkey on earth is going to die someday and be dead anyway. So you
Right.
can't. So we're all going to die anyway. You might as well just spend your life doing something you feel good about.
Exactly. It's much better. I can sleep at night, so
Yeah, and if you live your life with purpose, and when you take your last breath, you say, wow, that was great. I helped. I left the playground better than I found it. I
yeah,
did a good job. I tried to help. I live with love and passion and
that's right.
purpose, and it's
Exactly.
all good. But when you're
Exactly.
sitting there doing things you don't like to do for money, so you can get to the top of the hill, you're just going to be a life of misery and depression and
Yeah.
disease and all that.
I totally agree, Howard. It's true. Very good. Thank you.